And we're only available in about 1 hour. Within 1 hour. So after that, if I let you see the existing that I see. Alright, so that's the I'll be reviewing it. Alright, kat sini and wajib ikan this kind of thing. Wajib ikan I'm confident that you have cancer and that you need to drink. I'm serious. Just still see everything is well, I'm confident as well that Mr. Executive is in it. Now if you like a consultation with Mr. Executive, you need to stay outside and the patient in facility. Next, can you call that patient, please?
Okay, so what did the doctor say?
The doctor also she didn't check me or see anything. She said I'm having cancer.
What? You have been cancer?
Yes, she said that I'm having a cancer.
But you didn't do any test or imaging?
Yes.
How can she know you have cancer?
I don't know. So that's why I want to see that.
Okay, let's move it down. Excuse me. Is Miss Zanti available right now?
Actually, she finished her surgery just now.
Can we move her right now?
Yeah, I think she will bring it to you.
Okay, so that's the end for the first part of the video.
Warna ini sir, 44.
Sorry. Okay, so if you look at how Dr. Arisa talked with her patient, we can look that there is so many problems done by Dr. Arisa. Okay, so first of all, she actually neglects her professional responsibility for standard of medical care to her patient, in which she doesn't take a sufficient assessment of history, examination, and diagnostic investigation before giving the actual diagnosis to the patient. She after asking a few symptoms, then she immediately tell that her patient have a cancer. Okay, the second one is impolite behavior towards the patient. Okay, even at the start, we can see that the doctor is very unprepared for the consultation, and she's in a hurry to finish the consultation. That she didn't even ask the history in details, and at the end, after telling the patient that she has cancer, without giving the patient time to digest that the diagnosis, she immediately called another patient into her room. And lastly, she has a poor rapport building skills. In that sense, we can see that at the start, she only asks the patient's name and then immediately started the consultation. Okay, and the last one is she has poor skills in breaking bad news. Okay, so as has been explained by previous presenters, okay, spike is one of the ways to deliver bad news. Okay, so we can see, okay, first setting up interview. Okay, that doctor is not prepared for the consultation, as like she she is very in a hurry to finish the consultation with the patient. Okay, next, the second one is perception. She actually ignore the idea, concern, and expectation of the patient, as she does not even ask like if the patient actually knows what is going on with her. Okay, the third one is invitation. Okay, after like asking a few questions, she then immediately tells the patient that the bad news, which is cancer, without saying any warning signs, which can cause the patient to feel very shocked, as she was initially very healthy, apart from a few symptoms. Okay, the fourth one is knowledge. She does not even explain on the disease and the treatment option. She only said that she has cancer and then you're going to need a surgery. And then the patient does not even have time to ask in detail about the disease and the treatments. The fifth one is emotion. Uh, the doctor has no empathy to the patient itself, and she's very lacking in communication skills. Uh, as she does not consider the emotion of her patient, as and she even ignore the patient if when the patient seems shocked when she was diagnosed with cancer. Okay, and the last one is summary. Okay, if you look at the consultation between Dr. Arisa and the patient, we can see that she's actually doing a doctor-centered consultation, as she does not consider the patient's side, and she only deliver what she wanted to, and she does not even summarize the consultation and ending the consultation abruptly. Okay, so for the next two tasks, which is first, how to break bad news properly. We can see how Miss Izati break the bad news to point nine properly. And the last one is addressing junior doctors, which is Dr. Arisa's unprofessional behavior by Miss Izati.
Okay, so may I know what is
Aina, can you increase the volume if possible? Otherwise, it's okay because we can read the script. Yeah.
I see. So, I'm looking at you, I think it's extra and I think right. So I think we need to proceed this with the get the to that candidates. So is that good? So what we will do, the evidence to make verification. Like everybody, for the investigation, we will need to Well, I think this morning you have seen the question, right? Honestly, I feel like you will be disciplined and giving improve your service to customer. Supposedly, when you first met the patient, you should prevent the test, questions, what you're doing, sharing, simple as that. Then you can proceed with your patient people, hire them, and then with your first examination of the in that way, you will have your direct information. Well, that's understandable, but you should be more conscious of properly getting so that you understand the effect. Because cancer is really most of the people. So when breaking bad news, only use principle, site principle in order to deliver it quickly. Because we don't want to give much stress to the patients and also patients who might be. That's what I really like about university. So I think, yeah, I really is even more difficult so that we can or and more safe and
Okay, so that's the end of our presentation. Thank you.
All right, thank you, Aina, and your other group members for that extraordinary presentation. You did prepare 3 set of video presentation. So the first video, you enlighten us about what is the case all about, and then you show what is the subsequent correct reaction should be done when facing the patient. And the third one is about communication between colleagues. Okay. I say it's extraordinary because you make us understand more about the situation, and you give extra effort by preparing that 3 different scenarios. The content is clear. I think everyone can understand the message that you would like to share in this presentation. I think about may I just give some add-on value for the second video. So possible that if you have family members in the consultation room, offer for the husband example just now to sit down as well, right? So that the husband can be more comfortable and it's easy for you to assess the situation, and after that give the information and also possible the diagnosis. Second, you realize that sometimes patient in the beginning, even during history taking, they don't like the supportive staff to be there, right? They would like to make it like more confidential, even though it's just for a fever or sore throat. So sometimes what you can do that even even not during breaking bad news pun, even during the consultation, it's possible just between you and patient or the patient family members if they want. So tidak semestinya masa breaking bad news saja you ask the staff nurse. And sometimes staff nurse pun lagi suka tak ada kat situ sebab dia boleh buat kerja lain. Alright? Okay. I think that's my comment. Otherwise, kalau tak melampau lah, if I can comment, in reality, in future, I would like to remind myself as well. If you would like to tell something to patient, try to put down your things macam buku ke tab ke pensel ke, put it down. No need to hold that while talking to the patient. Maybe you can touch it for a while, but when you would like to answers question by the patient, sometimes you pause anything that you face the patient. I think the way that yours Miss Izzati facing the patient is good at the direction of the patient, but she's still holding the things and referring to the book, I think, to the tab. So I think maybe can be improved further. Otherwise, I hope that I will be like Miss Izzati, whereby patient looking for me dekat counter. Hopefully I can be like that as well, right? About the third scenario, in real life, it's not that direct, right? It's difficult for you to actually give advice to the other colleague in the same department or even in the medical faculty. In your case, you give example of a boss, like a specialist to a medical officer, right? So I think that hierarchy make it more formal for the junior to accept the advice from the senior one. But I would like to throw a question back to your group. How you would like to handle if, let's say, that you need to advise your same colleague, same age as you, same level as you in terms of experience, but you notice that they did something wrong to patient. So how would you advise them? Yeah, how? Anyone? Aina and friends? Because in real life, it's not that easy, right?
Maybe we can just
Mm.
indirectly tell them like how I did the actual thing. So they would understand that what they did is actually wrong.
I see. Yeah. So you share, macam mana tu? You share the good things that you have done, ke?
Yes.
All right. Okay, great. Okay, other than that,
I'm sorry,
yes,
but
Afisa.
my suggestion is sometime when we do like what Aina said, sometimes people just don't get it. So I think sometimes depending on our friend, depending on the person, I think sometimes we can be direct to them, just say.
Okay.
Uh,
So
so
direct
they
to them.
can just be direct, but it depends on our friend. If we know them,
Yes.
we didn't get the point, so I think we can just be direct so they will understand. But we talk to them in a proper manner, so they won't
Okay.
be hurt by our words.
So maksudnya cubalah. Try first. Just say what you want to say in a proper manner. Hopefully she take it. Right. Okay. Any other way? Great attempt. Any other way? I mean, one more attempt, then I will share my opinion. My opinion might be right or might be wrong. Any other attempt possible? Anyone from your group? Or anyone from the other group as well? Okay, I just, for the sake of time, I just share lah. So I think, from my opinion, it's difficult actually to change someone else. And it's difficult to let someone else to agree with your advice, especially when you are actually telling that they are wrong, right? So I think you know your friends, you know your colleagues. So if your friends is the closest ones to you, like your best friend that will never get hurt with you because you always belanja dia makan ke, selalu tolong dia ke, this is like your apa kamcing punya kawan lah, yang usually ketawa bersama-sama, sedia bersama-sama. I think she or he will accept your advice because she or he knows you and know that you will do the best for them. So that's no problem. But you've got someone yang neutral that you're not really close to them, I think don't be rushed to tell that things. Possible that you give something extra, like belanja makan dulu ke, good things ke, ajak keluar ke, make them feel happy first. Make sure that the level of emotion is already positive in a higher level, so that when you give something a little bit bad in terms of advice that will actually disturb their emotion, they will not be disturbed much. All right. Or you can actually tell a story. Like I think I now say that song, but not about your good things that you done, but you can say that, oh actually kan tadi ada pesakit datang komplain, but you don't tell who. Don't know. Dia datang komplain, ada bagi tahu yang actually ada seorang doktor ni buat teruk lah dekat dia. Kesian kan pesakit tu. Kalau kita harap kita tak buat macam tu lah kan. So you tell in general. Hopefully she mungkin rasa atau tak terasa atau teringat, but she know that, oh, the complaint have been made. So she worried possible that do not want to do it again. But you say that saya tak tahu siapa. Saya tak tahu siapa doktor sebab pesakit tak bagi tahu. Or you don't elaborate who are doctor that being complained. So that you as if like neutral, but you just sharing the information that kalau kita kena buat yang baik-baik lah dengan pesakit macam tu kan. So you tell in general. So as if like you tak bagi advice, but you give a story with some reflection. This is my opinion lah. I might be wrong. Otherwise, what I can share is quite difficult. But sometimes if we just keep silent, I think changes will not occur, and we not do some benefit towards the system. So we need to change as well, but it takes time. Yeah. All right. Thank you very much to the group. I think any feedback or question that you would like to share?
Doctor,
Yeah.
regarding your question just now,
Mhm.
is it possible for us to ask a higher rank doctor with high position to give advice to our friend if
Okay.
we are scared to do so?
Okay. I think by telling other person, we are actually involving more people. So when you involve more people, I think it's not. It could be one of the option, but I won't agree with the best option lah, because sometimes we do not want to spread some other what you call that, keburukan. If you feel that you can do it first, why not you do it first and you try. But if you notice that orang ni memang membahayakan orang lain, and during the system that you can't wait and you feel that you have no power or capability to do so, then definitely you need to inform the superior. Yeah. But if something to do with just ethics issue or something like miscommunication, I think you can just limit the number of people so that it's just between you and that person.
Thank you, Doctor.
All right, thank you. So we proceed to group G1, right? After this, right? G1, right? Thank you.
Assalamualaikum warahmatullahi wabarakatuh. And very good evening.
Macam putus-putus. Is it my problem with my side or problem with your side?
Very good evening. I be to all my batchmates here, and
All right. Thank you, Adrian.
can you hear me?
Yes, I can hear, but it's intermittently paused. It's like a lagging. I think it's okay.
Oh,
Just proceed.
Okay.
I think similar, but it's okay if you just proceed with the presentation. Possible we can follow.
I will start my presentation. So, group members of the
Okay, maybe next slide. I really can't hear you. Next slide. Right, summary of the case. All right, next slide. Okay, it's similar, right? So next slide. Next slide. Okay, maybe someone can present on behalf of Darwish.
Assalamualaikum warahmatullahi wabarakatuh. My name
Salam.
is Farah binti Abdul Aziz. So for the first task, based on the situation, these are the problems that faced by Madam Zakia and her husband. So firstly, Madam Zakia in the first place came to the hospital that day worried about her condition. So here she must be hoping to get reassurance and also maybe solutions from the doctor. Then after they were assigned to see Dr. Y, they actually didn't get to have proper communication with Dr. Y because Dr. Y just taking it lightly and he seemed to show no interest in the conversation with Madam Zakia and her husband due to his busyness. And actually he didn't bother to listen properly to the whole story from Madam Zakia. And after that, when Dr. Y bluntly told Madam Zakia that she has cancer, Madam Zakia and her husband must be very shocked and also upset to receive the bad news unexpectedly without any warning prior to that. Plus, Dr. Y didn't even go into details during their conversation or did any examination to make sure or to confirm the diagnosis. And lastly, after receiving the bad news, Madam Zakia actually did not get uh, any explanation or the chance to ask questions regarding her condition as Dr. Y straight away rushed to attend another patient. Moreover, Dr. Y just asked the staff nurse to call another patient when Madam Zakia and her husband were still in the clinic. He told them to leave as like he is pushing them away. So this situation actually must have been very unpleasant to Madam Zakia and her husband. So that's why later they report it to Dr. A and ask him to educate Dr. Y. So next, let's see the video prepared by us.
Assalamualaikum doktor.
Waalaikumsalam. Please take a seat. Have you guys eaten your lunch?
No, doctor. We cannot eat because we are frustrated.
Why?
Just now, when you were busy, the nurse told us to see Dr. Y first. However, we don't like her behavior.
What did she do?
The doctor said my wife has cancer, but she don't inspect properly.
Oh, I'm so sorry you have to experience that. Right now, let's try to get a full check-up, shall we? So, Madam Zakia, after all the investigation done, I'm afraid that I have some unpleasant news for you. Would you like me to go on?
Yes, doctor. Please continue.
So the test, unfortunately, shows that you have colon cancer.
Really, doctor?
Is it that bad? Can she really be treated?
Fortunately, your wife's condition is curable. You can try to treat it with surgery and then you can follow with chemotherapy.
Will the procedure affect my life? Because actually, I am working and I have 4 kids to take care of.
I understand your concern and I thank you for expressing that with me. So I will now share the details about the procedure with you. Madam Zakia, do you have any further question?
No, doctor. However, I don't like the way Dr. Y talked to me just now. Could you please educate her? I think she is very rude.
Inshallah, I will inform her. And I thank you again for your concern.
You are welcome, but I will never recommend her to my family or friends. Doctor, did you call for me?
Yes, please come in and have a seat. So, how's work today? Do you have any patients?
It's quite a hectic day the patient came with dysentery for 3 months, and she also had loss of appetite and loss of weight. So I was sure she had cancer. So I told them, Madam Zakia has cancer, since I have lots of patients to attend to. Plus, she will meet with you again after that. This one, you know we cannot do that. We should see them as humans with emotions and feelings. And we have ways to deliver the bad news to them. How can you be so sure it is cancer? There's no 100% in medicine, right? We should only deliver the news after it is confirmed. So how do you break the news to Madam Zakia?
Well, I just told them directly because I have so many patients today.
We learned in our med school before this, right? There's step in breaking the bad news to patient. The first one, we should warn them so they will not feel shocked, they will not feel afraid. And then the second thing is we have to give them space, we have to give them time to digest everything, every information that we give to them. And then the third one, and the most important thing, is to have empathy with our patient. We should see them as our patients and not just a case. So I hope after this you can improve your way to treat your patient and also to deliver the bad news to them.
I see. I'm sorry, doctor, and thank you for your advice. I acknowledge my mistake and I will try to improve that.
Thank you for listening. You can leave now.
Thank you.
Anyone would like to say something? Or is the end of the presentation? Is the end, right? Thank you very much for the group for that very wonderful presentation, concise. I think it's quite similar as other previous group. But I would like to comment on the last video presentation whereby the doctor keep on telling the specialist or the superior that I'm sorry, but I will have a lot of work. I have a lot of patients today. So whenever that you're becoming, I'm sure later on you will becoming someone superior in your department, in your society, or in your organization. If your junior complaining that they have a lot of work to do, they have a lot of patients to be seen, meaning that you need to take care as a serious issue to be settled. Otherwise, it will be a cycle. It will be a cycle whereby another issue occurs and the complaint will continue because the rights of your workers or the right of your junior doctors are not being taken care of. So meaning that yes, you are now your job is actually to tell her that you would like her to improve, but you also need to improve the environment so that it does not cause burden to your workers as well. So meaning that possibly that, oh yes, I realized that the number of patients nowadays is quite high. Oh, I'm sorry to know that. Yes, but I know that we need to maintain our characters and attitude towards patient. Let me say this, it will improve the way that you treat patient, but I will help you and your friends how to limit the burden. Possible that we make a WhatsApp group so that if anyone had difficulty in seeing patient can just notify me by WhatsApp group that I will coming down to help, or maybe you need to inform me so that I can actually include my MA or staff nurse to help with other procedures so that we can reduce the flow of all works towards the doctors during that point of time. So you try to give some solution so that the MO feel that their complaint also been heard. Not only that you are taking care of the patients and the customers complaint, but they're also taking care of the well-being of the workers, including the medical officer that have been complained. So that just my point of view. Any question or add on things that you would like to discuss for the group? If no, then I invite group A1 for the subsequent discussion. Thank you. Yes, group A1. Anyone presenting from group A1? Husna, are you presenting?
Okay.
Okay.
Oh, ada tu? Ada. Sorry. Okay. So, my group A1 was given a case of first impression. Next. Okay, so I just summarize the case given. So there was a 35-year-old lady admitted to this gynecology ward at 3 a.m. in the morning. So she complained of having sudden onset of bleeding to vagina. So there was a young male doctor attended her 1 hour after being alerted. The doctor looked drowsy, he yawned few times, and he also looked untidy. So the doctor started to ask the questions to the patient without introducing himself. He also raised his voice unnecessarily, and he didn't even answer the question asked by the patient. So he then performed physical evaluation to the patient without asking her consent and without accompany of a nurse. So he then just left the patient without explain regarding her condition. Next. Okay, so next. Okay, the first one is identify the unprofessional behavior displayed by the doctor. Next. Okay, so the first one is the doctor attending the patient too late, and he didn't even apologize to the patient by doing it so. So the second one is he has a bad appearance as he looked drowsy, he yawned few times, and he looked untidy. So this will give a bad first impression to the patient and her husband. Besides, he may look untrustworthy to the patient. So the third one is he didn't introduce himself and instead he directly asked questions to the patient. So he didn't build a good rapport with the patient, and this kind of attitude will make the patient tend to not to tell the whole condition in her own words. Next is he shows an unethical and unprofessional attitude as he raised his voice to the patient unnecessarily. The fifth one is he didn't listen attentively to the patient as he didn't answer questions asked by the patient. This kind of attitude is paternalism type of doctor-patient relationship. He looked in hurry, and this will make him look like lost or uninterested to the patient's problem. Next is he disrespect the patient as he didn't ask for patient consent before starting to do physical examination to the patient. And the last one is he didn't close up the consultation properly. Next. Okay. The second component is comment on communication skill of the doctor. Next. Okay, this first one is the doctor didn't introduce himself and started ask questions to the patients. So we as a good doctor should establish initial rapport between doctor and the patients. So this kind of attitude will allow the patient to share vital information to us, and the patient will be more open to us. And it is essential for an accurate diagnosis and better understanding of our patient's needs. Next. The second one is doctor raised his voice unnecessarily as if he is in a bad mood. So we should display a good non-verbal skills in which we have to maintain suitable or a good tone of voice to reflect genuine interest in the patients. And this will have a huge influence on how patients perceive us as their doctor. Next. The third one is the doctor didn't answer question from the patient. So by providing answers to the patient, it will help our patient understand better regarding her condition. And this will help to build confidence and serve as a reassurance for the patients to us. Next. The fourth one is the doctor didn't ask for permission before doing physical examination and without company of a nurse. So by asking patient consent before we start doing physical examination, it will it signifies that our patient is aware of what procedures are conducted on her. And medical chaperones promote sense of safety and comfort for the patients, and this will preserve patient dignity. Next. The last one is the doctor left the patient without explaining to the patient and her husband regarding her conditions. So explanation should be provided at a suitable level to allow accurate interpretation, and this will make sure that there is no miscommunication happen between the doctor and the patients. I will pass the floor to my friend Atira to continue the presentation.
All right, so let's move on to the next task, which is how to improve patient-doctor relationship. Next slide. Thank you. All right, so number one, any relationship, it stems out from trust. So number one is build trust and rapport. How do we establish that? That's why first impression and composure is really important. So the theme for our task is first impression and composure. First impression means how you appear from the first glance. So you need to be neat. If you just wake up, at least wash your face so that you appear awake, not sleepy. And then composure, be calm, control your emotions. Don't let that okay, the doctor in the case, he was tired because of on-call, right? But anyhow, we still need to portray in front of our patient the composure so that they will be confident with our approach and our treatment. Okay, number two is by improving communication skills. So this is the skills that need to be learned. We need to try to explain to the patient about her or his condition with the language that he or she understands. So we need to come to her level. So if the patient has a good background of medical knowledge, for example, the patient is himself a doctor, then you can use some terminologies. But if the patient comes from Kampung Orang Asli, try to suit the language to their understanding. Okay. Number three is by developing empathy. Empathy, to appear empathetic, you need to be interested. So non-verbally, you can show this by leaning forward instead of sitting back like this, and then listen attentively, and also acknowledge the patient's emotions. And number 4, before doing any procedures, make sure to obtain consent so that the patient feel more comfortable in what they expect the doctor will do, so that they feel safer, they are not threatened. So this will increase, again, back to number 1, trust. Okay, number 5 is in order to improve doctor-patient relationship, we need to instill mutual decision-making, shared decision-making. This means that the doctor is not authoritarian, so it's not just menyuruh patient to do this treatment, undergo this treatment, even though the patient doesn't want to. But as a doctor, he should explain to the patient about what are the possible, the options of treatments that are available, and what do we suggest the best for the patient, and then let the patient make that decision, make that informed decision. So yeah, the knowledge, the information is on our part to give to the patient, and then let the patient do their own decision based on what they want to achieve in their life. For example, if a patient is having stage 4 pancreatic cancer, just like the case before, maybe patient's goal is not really, now it's not about curing, it's about extending the quality amount of time that is left, more towards that. So maybe patient don't want to undergo chemotherapy. So we need to respect that decision, but make sure that all the information is delivered. Okay, and lastly, we need to maintain professional boundaries. So, we in some cultures, if the opposite gender, doctor and patient is the opposite gender, okay, in our culture, so it's not appropriate to hug. So that is the boundaries that we need to set. Okay, so next, let's move on to the 4th task. Next, the 4th task. Okay, what is chaperone? When after we obtain consent for physical examination, for example, we also need chaperone. So what is chaperone next? So chaperone is a person who acts as a witness for a patient and a health professional during a medical examination procedure. And a chaperone must be the healthcare professional. Wani? The chaperone must be the healthcare professional or staff member, like staff nurse. And then secondly, he or she should be the same gender with the patient, so that when the chaperone is the same gender, the patient will feel safer. All right. And then it should not be from a family member or friend of the patient. For example, like Dr. said, if the husband want to see, okay, can, but we also need to bring a chaperone that is from staff member or healthcare professional that is the same gender with the patient, because this is for legal issues. If anything happens, then we can we have someone to back up to as a saksi, as a witness. Next. Okay, why it's important to have chaperone? Number 1, provide significant protection for the patient. Like I said, that's why it's important to for the chaperone to be the same gender. and then he or she can assist patient in some sensitive situation. And also chaperone signifies awareness and respect the patient needs, which is the need to feel safer and more comfortable. All right, so lastly, let's look at the video the role play that we have prepared. Tak ada voice.
Okay, meanwhile your friends figure out the voice. Okay, what do you do?
Risaulah bang.
Tak apalah, bertunggu. Lepas ni kita jumpa doktor. Sorry Puan, minta maaf soal lambat, tadi saya dah sikit. Okey, saya nak tanya, Puan ada apa masalah? Kenapa Puan datang sini?
Saya datang sini sebab saya perasan semalam saya kulit maria ada berdarah sikit.
Yes. Tolong siapkan Puan ni. Saya tadi dah lakukan pemeriksaan dan saya dapat tahu punca dan masih lagi ada peluang pendarahan. Saya dapat
Is it Atira?
Yes.
Yeah, okay. Thank you very much. I like your presentation on that you try to reflect on the patient with pancreatic cancer just now. Yes, thank you for reminding me. So meaning that sometimes what patient require actually something that can improve their quality of life, remaining quality of life before they're going to die. So sometimes you might disagree with me that sometimes I'm not really forcing them to actually pursue with any choice of treatment. Sometimes they just want to say that, doctor, I feel like I would like to go back home. I would like to spend my time with my grandchildren, with my wife, and settle down any issue with wasiat and anything. I would like to prepare to be so that my family members and those that are going to live in this world going to be protected, something like that. So they take that time. So that rather than we introduce more pain of any other procedures or any surgical procedures or chemotherapy, it's better that we respect the quality of life that remaining that the patient have. Yeah, I agree with that. Okay, otherwise that video is concise. I think the message is clear. So I think I do not want to add furthermore. It's crystal clear. So we proceed to A2. Is that okay? All right, thank you, Atira and friends. All right, A2, Arif, right? Okay, Arif, if I can get help from you, possible that you can just run through your slide as just add on something that is not being covered by A1, and then after that you can proceed with the video. Is that okay? All right.
Okay, sure.
Okay.
I think I can.
Sure.
Okay.
I will read
Let
your
me-
slide. Yeah, we will read your slide later. Thank you. Don't worry.
Okay. Let me share my screen first, all right?
Yeah, sure.
Okay. Okay, so our group has been given the same task as A1, first impression, appearance, and on composure. These are the list of our group members. Okay, so same situation like group A1, this situation about a very doctor with unprofessional behavior in gynecology ward to a 35-year-old lady. Okay, so we have been given 4 tasks from doctor. The first one is identify and professional behavior, comment on the communication skill, explain about patient-doctor relationship and how to improve it, and the importance of chaperone. Okay, so the first one is the list of the unprofessional behavior. I think this has been covered by by group A1, right? The list of the unprofessional behavior shown by this doctor. If I want to touch this a little, okay, so we can firstly see the doctor are being unpunctual with his time because he attend 1 hour after being informed. The second thing is when he meets the patient, he leaves a very bad first impression because he looks unkept, untidy,
Okay,
and
Arif.
he
Sorry, maybe I can ask. So, what do you think the ideal time one patient should be seen by doctor?
I
What will be the
think
duration? Yeah.
regarding the ideal time, when the doctor are being asked, when the doctor have already get the appointment about the time with his patient, he should see his patient immediately. He cannot see the patient. He cannot delay his time and do something else before meet his patient, because meeting his patient is a priority. Because if the doctor wait for the patient too late, it could make the patient become more anxious and the patient could become more emotional waiting for doctor.
Okay, great. How's about consultation time? What is the best duration of time that a doctor should spend per patient?
Regarding consultation time, do you mean the time how long the
Yeah,
consultation time between doctor, or
So that
I
it
think it
doesn't
is
cause burden to the other subsequent patient who are waiting. Yeah.
I think it is below 10 minutes, or am I wrong?
Oh,
Because
yeah. Okay.
maybe below 7.
Yeah. Okay, great. Ideally, based on one article regarding consultation, it's about 15 to 20 minutes. But in
Oh,
Malaysian setting is something that is sometimes is difficult to maintain it because you have a lot of patient. Yeah, right. Continue.
okay. The next thing is the doctor is being disrespectful. When the doctor are taking history from the patient, the doctor always raise his voice unnecessarily, and he even doing the physical examination without getting consent. And if we analyze the doctor, we can see that the doctor is a very rushing person, because when he meet the patient, he doesn't greet the patient and doesn't initiate to establish a good rapport with patient, be getting the history from the patient. And we can also see that when after doctor doing the physical examination, the doctor leave the patient immediately without even summarizing about the patient condition or even giving the reassurance to the patient, as if he want to finish the things quickly. And the fifth thing we can see from the doctor is not a very attentive person, because he doesn't reply the question from the patient, and he even did not ask hear the complaint from the patient. And this shows how very bad ethic and very unprofessional the doctor is towards his patient. Okay, so the next part in my presentation is regarding the communication skill. So we are asked to comment about the communication skill of the doctor. Okay, the first thing is about the introducing ourselves. Okay, introducing ourselves is very important for every doctor, because it is a very first step for us to attending the patient and get to know our patient. So the first thing why introducing ourselves is very important, because by introducing ourselves, we can get to know more the information about the patient. So how to introduce ourselves to the patient? When we meet the patient, we need to introduce who are us, and we need to explain our role in our patient's care. And by introducing ourselves too, we get to review their medical record, and we can ask the basic get to know question. For example, about the patient's age, about the patient's family, about patient's living place. So that's the first importance of introducing ourselves. The second thing is, by introducing ourselves, we get to establish rapport too. So this is by we show good physical language by making an eye contact when introducing ourselves to the patient, and this can make the patient feel more comfortable with us. And we also should pay attention to the patient's concern. And we can also gain trust by introducing ourselves, because when we introduce ourselves, we can get to know more about patient, and the patient can become more secure towards us. Okay, that's the first. The second thing is raise voice necessarily. Okay, so as the doctor, one thing that we need to highlight is that we are dealing with the patient that can have more sensitive subject and information. So we should not raise our voice always raise our voice, and instead when we talk with our patient, we should talk with a slower pace, and we should talk with a calm, warm tone and easy to follow pace. So when we talk to the patient, we should also watch for the that being used by us, because as every word matters. First, we should not use the word that can hurt the patient's feeling. And the second thing is we should use the word that can be understandable by the patient. Because when we are using this word can be always be remembered by patient after our session consultation with the patient. And the third thing is did not answer question from the patient. So this show that this doctor have a very poor listening skill. Okay, so why listening is very important in medical consultation? Because listening is an active process that involves us in absorbing or imbibing all the information expressed verbally or either non-verbally by the patient. So listening, it is a very major part of communication process. By listening to the patient, it helps us in better understanding about the patient's problem and get us to have a better decision and solution to the patient. And their studies found that a significant proportion of patients nowadays are very dissatisfied because the doctor had not listened or understood the patient's problem fully well by not listening to their explanation and question. So us as a medical practitioner, we should always listen to the patient's concern, try to ask an open-ended question so that the patient can tell everything about their problems regarding their condition. Okay, next slide. Do not ask permission. Okay, this is the problem regarding the concern. Okay, concern is very important because it represents the ethical and legal expression of a person's right to have their autonomy and self-determination respect. And it is very unlawful for the doctors to treat patients in absence of consent or other authority. And do this could commit a doctor to the crime of battery and also the thought of trespass to the person. So how to avoid this? We need to ask the consent from the patient, and to make sure that patient feels secure, we need to have the chaperone that I will explain in the later question. And the last thing is leave without explaining the condition. If you look at this situation, the doctor doesn't give any summarizing about the patient's condition, and the doctor even doesn't give any assurance. As a good doctor, we should, after taking a physical examination and taking history, we should explain about the condition the patient is having, and we should give reassurance so that the patient can be more calm and the patient can trust us more. Okay, so that's about how to establish a good communication skill to the patient. Okay, next question. Okay, for the third task, we are being given the task about how could us as a doctor improve the patient-doctor relationship? Okay, so there are 3 ways on how to establish the doctor-patient relationship. Okay, the first thing is we need to build trust to our patient. So this how to build trust, same like I said previously, this how to build trust is we need to make the patient comfortable. And how to make patient comfortable? We need to be compassionate to our patient. This compassion can be shown by how we react to our patient story, verbally and non-verbally. By non-verbally, we must show that we are being attentive to the patient's question, to the patient's concern, and verbally, we need to always ask the patient and let our communication with the patient always being a mutualistic communication. Okay, and we need to also show an active listening action. Okay, that's the first way. The second way on how to improve the doctor-patient relationship is that improve communication. Like I said previously, always use an open-ended question in our conversation or communication with the patient. Because when we are interacting with the patient, we cannot be the only one who is dominant in the conversation. Because we need to get lots of information with the patient, we need to always ask open-ended questions so the patient can have their own space to tell about their condition and to answer question from us. So that patient can trust us and can easily be open up to us. And the third thing is shared knowledge. Okay, so regarding shared knowledge, because we have getting the history taking and physical examination of the patient, we need to explain or summarizing the patient's condition perfectly and clearly to the patient. We should not use the word that cannot be understood by the patient. We should use the word that the patient can understand. Then giving some option for the treatment, for the action that the patients can take so that their condition can be improved. Okay, answering the third task. And the last task is about what is chaperone and why is it necessary. I think this has been asked by the previous group too. So chaperone is basically a person who act as a witness for a patient, and usually they are health professional during a medical examination procedure. Okay, there are some importance of a chaperone. For our group, we have list importance for the patient and also for the medical practitioner. Okay, the first thing is the importance of chaperone to the patient. By having the chaperone together with the patient, this can ensure the patient safety and dignity, because usually we will use the chaperone that have the same gender as the patient. So this will make sure that the patient are feel secure when we are doing the physical examination or any medical procedure to the patient. The second thing is the importance of chaperone is that to facilitate the communication. Sometimes there are patients that are shy or reluctant to tell about their condition to us as the doctor. By having the chaperone, this chaperone can help us to convey the message from the patient to us easier. And the third thing is emotional support. When we are doing any medical procedure or physical examination, there are some patients who are feel anxious, who are feel alone, and they need some support by another person. By having the chaperone, this chaperone can act as emotional support to them, so that they can feel more secure by having any treatment or examination from us. And next one is the importance of chaperone to healthcare worker. The first importance of chaperone to healthcare worker is provide assistance, because sometimes, like I said previously, we sometimes the patient have problem in communicate well with doctor, especially for the physical examination and any procedure. So this chaperone can help the healthcare worker to assist them in get the information or from the patient. And the last thing is provide protection against allegation, because nowadays we all know that there are lots of patients who are genius, or most of the patient now know about the legal, and they can sue us by any action from us. By having the chaperone can act as an alibi or evidence for our part, so that we cannot be easily sue or taken any legal action by the patient, because the chaperone act as the evidence for us. Okay, so I think that's answering the fourth question. So now let's proceed to the video. Okay, I'll play the video, doctor.
Assalamualaikum, Dr. Danish. Dr. Danish,
Wait,
ada seorang
everyone can hear the voice?
buat
Yes, can.
sakit Mak Aminah di kaki 8 saya.
Tempat Aminah. Ini song fighter. Saya Cik Abi suami Aminah. Hai. So sebelum saya nak tuliskan ni, saya Dr. David. Saya apabila buat kain saya lagi. Sebelum tu saya nak tanya. Umur berapa? Dan puan datang ke buat kain ni sebab apa? Jadi puan berasa berada di bawah pukul berapa? Jadi episod pertama puan ada bagian dalam bawah. Sebelum tu puan ada perasaan tak perubahan yang tak darah keluar dalam saya bagi jam dalam cawangan. Okey. Boleh tak saya nak tanya waktu puan keluar darah dari bahagian bawah, puan ada rasa sakit tak? Dan saya nak tanya puan last datang berapa bila? Sebelum saya nak tanya puan sekarang stress itu sekarang. Lepas stress itu saya nak minta buat sedikit saya kat atas puan. Apa ni? Biasa ni aku bisa pelurutkan bahagian bawah untuk cek punca pendarahan dari bawah dalam SCMC. Perusahaan yang nak buat ni, doktor buat seorang juga? Oh tidak, saya akan panggil seorang jururawat dari campuran saya. saya tidak bersama dengan patient seseorang adalah untuk memastikan saya tidak masalah lakukan isteri. Okay, sebelum tu boleh tak saya minta Encik Amir di luar sebentar saya nak aku mengatakan isteri. Kalau saya nak sebut buat bagi bawah sedangkan ada satu kesimpulan dekat kawasan buat untuk tahu kesimpulan itu apa dan biasanya kita terpaksa buat apa sendiri ujian makmal dan buat scan untuk tahu apa kesimpulan itu sebenarnya dan kami akan datang untuk panggil korban selepas kami dapat result pun untuk bagi tahu buat apa dia kita InsyaAllah boleh sembuh. Jadi sebelum itu kami akan pantau mana dekat blognya untuk tengok hasil keluarga kita pada dari bawah. Okey, betul tak?
Okay, so that concludes our presentation from this video. So in summary, we have explained to everyone and even demonstrate to us to everyone about how to be a good doctor in terms of communication, in terms of interaction with the patient. So I hope that everyone can practice this in clinical soon. So doctor, do you have any comment?
Thank you very much, Arif, for that presentation and sharing. I don't have any add-on comments. I think both of your groups have covered that well. Yeah, I think I like the history taking just now by your friends that they try to quantify the amount of blood. So I think you already know the tricks and tips in taking history taking pertaining to possible gynae history, right? So we proceed to subsequent group. Before that, after this, it will be Asa. So for those who would like to pray Asa, you can just proceed even though we are still presenting. I'm hoping that if anyone would like to go for Asa can just go. I just let me continue with the presenters. Inshallah, you can joining back later if you would like to pray Asa. Okay. Can I invite group I1? Thank you.
Can you see the screen?
Yes, you are sharing screen, but the slide not seen yet.
Can you see the slide now?
I cannot see the slide yet. I just see your desktop. Yeah, now I can see.
Assalamualaikum. We are from group I1, so we present the 9 case. Next slide, please. Okay, so before that, I introduce our member. Okay, no need for that. Okay, so we proceed with the case. So our case is a young man was brought to a hospital following a motor vehicle accident. He was bleeding from a laceration on the hand and was in severe pain from a fractured femur. The staff attending to him at the hospital was keen to know how he would be paying his deposit. They wanted to know if the family would be able to pay the deposit before calling the surgeon on duty. This led to an exchange of words between the staff and the patient's relatives. An ambulance was summoned to transport him to the nearest government hospital for further care. This incident led to a complaint to the Ethics Committee of MMA regarding the unprofessional attitude and priorities of the hospital staff. Next slide, please. So for the first task, I'll be presenting. My name is Farah Adrenaline binti Muhammad Shehzatlin. So the first task is to identify the unprofessional behavior shown in the case study. More concerned about how the patient is going to pay the hospital bills rather than treating the patient, especially when the patient is in severe pain. I'll pass to the next presenter. Thank you. Okay, next I will, my name is Nurainda Miaviti Jamari, and I will continue with the medical professionalism that is lacking in this case. So next slide, please. So as we all know, as we all learned yesterday, medical professionalism consists of two E's and two C's, which are the expertise, the ethical, to communicate, and the compassion of a physician. Next slide, please. So the medical professionalism that is lacking from this, in this case, is the professional fee. I will explain later. Responsibility for standards of medical care to patients and the practitioner and request for consultation. Okay, next slide, please. So what is meant by professional fee? So any physician should avoid any conflict with the patient on professional fees charged by him after the treatment. So this can be avoided when we provide the patient written information on estimated charges and the basis for them before the treatment is commenced. Okay, so in this case, our patient is seen in an emergency department, and the attending staff is keen to know that the patient might not cannot afford to pay the deposit, but they do not give the care that he needed. So another thing to note about professional fee is we need to avoid improper or unreasonable and unjustified professional fees other than the relevant schedules or the relevant diagnosis. Okay, next. Next, we have the responsibility for standards of medical care to patients. So as a physician, we need to have a conscientious assessment, meaning that we need to take the history, symptoms, and signs of the patient in condition and do thorough professional attention. And then we consider management and prompt action and the readiness to consult and refer patient to appropriate professional colleagues. Like in this case, the attending staff should refer to the surgeon in charge, because as we know, he have laceration on his hand and might break his leg. Okay, next. Last one is, next slide please. Okay, the practitioner and request for consultation. A medical practitioner should arrange consultation with a colleague whenever the patient desire it, provided the best interests of the patient are so served. Meaning that in this case, also we refer to the case, the patient needed to see a surgeon to evaluate the situation. So whether the patient need an emergency surgery or need immediate care, so we need to consult the professional. So it is better if we are the primary caretaker, it's better to suggest second opinion in all doubtful or difficult or anxious case. I think that's all from me. I pass to the next presenter.
So, Assalamualaikum. Can you hear me?
Yes, can.
Okay. So, my name is Muhammad Kuman Hasbin Asran. So, I will answer the question of what is the primary obligation of a doctor. So,